Hi everybody, I'm Dr. McCoy. What I'd like to do is just demonstrate how a low force type of adjusting works. There's many different types of adjustments, and I'm going to demonstrate a type of technique called, we're going to be using sacrooccipital blocks. So here's how a low force or non-force technique looks. Okay, we're going to just first check the leg length. And Casey, go ahead and turn your head to this side for me. Just your face to this side. Good. And when she turns her head, the right leg actually goes even shorter. And that actually means that one of her cervicals is rotated. So you're going to go ahead and put your face in the middle. And right now one leg is shorter. That means there's a rotation here at the pelvis. When she turns her head, the short leg side gets even shorter. That means the dura, which is the lining of the brain and spinal cord, is being pulled up here at the upper cervicals. So it actually shortens her leg even more so. So that's what we're going to be working on balancing out. You're going to turn your face to this side. And when she turns her head to that side, the short leg actually evens out. So she only has a subluxation on one side in the upper cervical. So we're going to go ahead and turn. So with this really light one adjustment, we're going to be correcting her pelvic rotation and the upper cervical subluxations. All right, so we're going to take, these are adjusting blocks. Good, and you're going to go ahead and bend this knee. We're going to just test, hold strong. You're going to check over the sacrum. And the muscle test goes weak, which means the sacrum is probably posterior. There's a subluxation here. Good. And so we're going to put one block underneath one side of the pelvis and another block underneath the other side. And while she's on the blocks, her pelvis was rotated this way, and we're bringing it back and shifting it this way. So now her pelvis is in a neutral position. Good, you're going to breathe deep. Turn your face to this side. Good, when she turns her head, there's no extra shortening of the leg. Turn to this side. Good, and back to the middle. And go ahead and take a couple deep breaths. We're just going to do a little extra, it's called inspiration assist on the sacrum. In and out. Good. And her head is releasing because we've just released some tension from the dura. Take a couple more deep breaths. And normally I would leave the patient on the blocks for about 6 to 8 minutes, but we're going to just, even just a little bit, it's going to create a shift. Or even go ahead and turn your face to this side, and there's no extra shortening of the leg. That means there's some pressure being taken off of this upper cervicals, and back down. Good, and then turn to this side. Very good, and back to the middle. Okay, go ahead and sit up.